Chief Pat Dale. And I wanted to just welcome you, Chief Dale, to the Facebook Live event. And first of all, how are you doing? How's your family? Are you staying safe?
Yes. So Dr. Schrier, thank you for having me. It's my pleasure to be here. And thanks for asking that. My family is doing well. We're actually all, fortunately, here at home. We're staying home and staying healthy. I have a college-age son who's in his senior year. He's upstairs finishing his thesis right now at home, which is very unusual, but we're here and we're healthy. Thanks for asking.
That's great. What is your son studying?
So he's studying, thank you, mechanical engineering.
That's great. Fantastic. Well, congratulations to him. And I just have a question for you. Right now, I'm not practicing medicine in my old clinic because I'm doing Congress full time. But I think about what it would be like to be in clinic all day, potentially exposed, and then come home and potentially expose my family. And I was just wondering if you feel that way as a fire chief, where you're out and you're responding to emergencies. You don't know, because asymptomatic people can spread this disease. You don't know who has it, who doesn't. What's your routine when you come home from work to make sure that you don't spread this to your family?
Right. Well, the answer is that I'm actually, my workspace is an office since I'm a fire chief, but I'll speak for our first responders on the front line only to say that I have 38 years in the fire service here in the greater Puget Sound, and while I usually like to talk to our frontline members, like, I know what you're going through. This is one case that I honestly don't, because I never had to wear a mask on calls. I never had to take my temperature before entering the fire station, or sometimes before entering incident scenes. So I have talked to them, and I understand it's actually difficult. They're sometimes greeted by people that are afraid of the way they look. Communication becomes difficult through a mask.
Sure.
And it's complicated, and already sometimes complicated response to help people, even more so with keeping our members safe.
I can understand that. Well, please thank them on my behalf, and I'm sure everybody listening today. I wanted to talk with you about fire season. It's coming up. Last year, I did a couple of fire-related town halls to get people in the district, both on the east side of the Cascades and the west side of the Cascades, just prepared. What do you need to do in case there's an emergency? We're getting drier and hotter seasons, and so we're now seeing risk even in the wetter parts of the state. And then we ended up having a very mellow summer, and we were all really grateful, felt like we kind of dodged a bullet. And I was wondering, how's this year looking? And did the lack of fire last year potentially set us up for a worse year this year?
Right. Very good question. Thanks for asking that. So I appreciate that people will be able to see this, because we're actually predicting a more increased than normal fire season. And that's really due to what you've already alluded to. Last summer, we were all geared up for an extreme summer and a lot of wildland fires on the west side, and they didn't come because of the cool, wet weather that we had that mitigated that last summer. Unfortunately, last summer leading into this past spring, March and April was very wet. That seems like it would mitigate the fire threat going into the summer, but actually what it does is, on the west side here, we grow a lot more greenery, brush, shrubs, trees, and then go into a dry summer that's predicted, and that fuel load is increased a lot over a couple of years ago. So we're anticipating drier than normal. We're already seeing that in some parts of probably your area. And so with the increased fuel load and the dry weather coming, we're anticipating kind of a nasty fire season.
Oh boy. And then all you need to add to that, once you've got the fuel and the dryness, is a couple lightning strikes and a wind, and you're looking at a disaster. And then meanwhile, when we have these kinds of wildland fires, you have a team of firefighters together working in close proximity. You eat together, you camp together, you work together in tight quarters, and we're also in the midst of a coronavirus pandemic. You know, nature doesn't choose. You can't just get one emergency at a time, and you could be facing both. How might that affect how you respond and your ability to work in big groups?
Right. So I think the coronavirus, as you talk about it relative to the fire season, is going to complicate matters even more, because we are trying to limit the resources that are coming together at a scene. And first of all, I anticipate even by summer, we're still going to be wearing the protective masks and goggles and the PPE relative to the virus protection. And so that complicates it. And also just the crews coming together in close proximity, that's going to complicate the decontamination process more. I also see a relationship between, my experience with brush fires here in the West Side is they go on for a long period of time, and they tend to create a large smoke cloud that'll lay over a large area for a long period of time. And this pandemic, being a respiratory disease in nature, I think is going to cause subsequent calls relative to EMS problems with our citizens and their respiratory. That's going to double up on response at the same time, and I'm worried about the available resources caused by that added layer of medical response due to the SARS type nature of this pandemic.
That makes sense. You know, already having some effect on our lungs, a pulmonary disease, it almost is like turning us all into smokers and potentially increasing our risk, and particularly your risk. And I would imagine, you know, you need different kinds of masks for each one. You know, you're going to want an N95 to protect you from coronavirus, but you have your other masks that you use to protect you from smoke and particulates. Do you know if you can wear them at the same time? And if you do that, can you get enough air in? Will that work for you?
Yeah, that's a good question. So I don't think we've got that far in our deployment planning yet. But again, just the notion that I predict, even in the summer, we're still going to be having to have PPE worn. It's going to complicate. Again, my point is probably just it's going to complicate our response and ability to protect our frontline first respond firefighters so that they can continue to deliver the service. It's going to add another layer of complication. Yes.
Yeah, absolutely. And I think you're right that when you flatten a curve, which is important to not overwhelm our healthcare facilities, to make sure that we have enough beds in hospitals and our healthcare workers don't all fall ill at the same time. When you flatten it, you also lengthen it. And so I think I agree with you. I think that this is going to be going on potentially for well over a year. I mean, really until we have a vaccine. So everybody brace yourself. I wanted to ask specifically about fires. What can people do to protect themselves and their property in the case that there is a fire?
Okay, thank you for asking that, Doctor. One thing that several around here in the fire service are beginning to talk about is the 4th of July. And we're becoming increasingly concerned and even worried a little bit about this intersection of, typically we tend to advise people to go to, the larger scale professionally run pyrotechnic displays just for the fire safety aspect of that. And because of not wanting to assemble large groups of people, I don't think those are going to be occurring, which is probably necessarily going to drive more private and home displays and discharges, which increases the threat of injuries, number one, and fires. So what I'd like to bring up is people to please be aware of the increased fire danger because of what we just talked about, the dry, hot summer coming, and to be safe and legal in their displays of fireworks, that they're always supervised by an adult, that they have a means of extinguishment in the immediate area in case there is an accidental start, that there are eye protection. A doctor, in my 38 years, I've seen loss of digits and eyes with home discharges, and I certainly want to, and we plan to, our community outreach portion of Grand Fire and Rescue is strategically planning when to message those safety precautions, because we want to be ahead of that potential occurrence.
Well, thank you.
So thank
And, I would add to that as a pediatrician, for children, often the injuries are the next day when they see these things on the ground and don't know that they haven't already been exploded, and they can cause major damage. So be careful the next day as well. And I just think everybody needs to, it's all about risk and benefit, right? And fireworks are fun, but in this year, they put us at heightened risk of fire, but not just that, they put our firefighters at increased risk at a time when they really can't afford to have to be out working unnecessarily. So I would just ask everybody to consider how important it is to you to do this, or to have a campfire, or whatever it is that you're adding risk, not just to yourself, but to our firefighters. So I'll just leave that food for thought. Now, let's say people have to evacuate. I don't know if this has ever even been an issue in Graham, but in the eastern part of my district, evacuation is a very real thing. I think we should start thinking about it in the western part of my district, because we're getting drier. This will at some point become an issue. What should people think about, and why should they think about it now instead of once the fire department tells them it's time to evacuate?
Great. Another great question, Doctor. Thanks for asking that. So we do have some experience with neighborhood type evacuations, not to the scale of Eastern Washington, of course, in our district. And along with our counterparts, the first responders, the police that help us do the evacuations. First of all, I would advise, as you're suggesting, that people think about it well ahead of time, have kits prepared so that they can, at a moment's notice, a knock on the door, that they can grab what they need. The pictures, pills, and pets, I say, are important to people in their house fires, and sort of that go bag, have that ready, and have a place predetermined where they're going to meet, and then where they're going to go to. And those are standard things that we'll communicate on our website and through social media as we prepare. So those are things that people can, and please, when they're asked to evacuate, do so, and this way that they're prepared, they can do so quickly, which helps stream people out of the neighborhood more quickly.
And you said and pictures. I've heard this referred to as a whole bunch of P's, like people, pets, pictures, papers, like your special documents, your passport, your birth certificate, that kind of stuff. I've also heard, what's the other P? Do you have some other P's?
I don't. I've just always said in relative to house fires, what's important to people that they get, it's remarkable, is pictures, pills, and pets.
That's right.
Your papers is a good one. I'll add that, I think.
Perfect. Plastic, probably good to have your credit cards, or at least photographs of them, just to take it with you. And if you take pets, take pet food as well. And in terms of having a place to go, fires don't always hit when everybody's at home together. So if you have a child at school, parents are working in different places, have a pre-designated meeting place. Often whichever one is designated by your child's school is probably the good one to use. And maybe one contact person who's out of the area to all connect with, in case you can't find each other, or in case, like in our case, our child doesn't have a cell phone. So just some other things to think about. So go to your, what is your website so people can consult that?
Yeah, grahamfire.org.
Great. Perfect. Yeah. Easy.
Sure.
We got a question about burning yard clippings, yard waste at home, and whether people should be doing that, and if they can, whether they should be notifying you first.
Yes, good question. Thank you. So within our district, we do issue burn permits, and so it outlines what precautions are necessary and the size of the fire. And we're currently still issuing burn permits just until there is the countywide burn ban that'll be coming probably sooner than later. But we do have a system to issue permits for that type of burning, as long as it's in the correct area and they meet the guidelines.
Great. Same website, I presume.
Yes.
Okay, great. And then what about volunteers? How can we help you?
Great.
Um, Packing meals? Yeah, how can we help you?
Thank you for asking that, Doctor. So we highly value our volunteers in Graham Fire and Rescue. While we have 97 career firefighters covering our 70 square miles of our district and the 70,000 population, it's 97 career firefighters, but we also have 16 volunteer firefighters that we highly value. And so there's three ways that there's an opportunity for people to volunteer in our department, and that's to become a come from home volunteer firefighter, a
Mhm.
resident firefighter, where they're actually assigned to platoons and the shift and whole shifts. And mostly those are firefighters that want to become career firefighters, but we totally value having them in our effective fire force. And then we also have a support services division with about 12 people currently that support our operations. So there's three opportunities to volunteer with Graham Fire and Rescue, and we're going to be recruiting. It's open now. You can go to grahamfire.org, learn more. We'll have a recruitment for those volunteer residents and firefighters in September, and then put them on the force by the first of the year.
That's fantastic. Now, do you still have firefighters in the firehouse? Spending nights there? How are you protecting them from coronavirus?
Yes. So early on, when this in early March is really when we took the measures to close the fire stations down to the public to eliminate that risk, we actually started protecting our firefighters immediately with all that PPE. And then we've eliminated movement from station to station as much as we can to reduce, again, that exposure amongst our members. And so that's the steps that we took early on to mitigate. But I want everyone to know that every fire station is open and staffed to our normal levels. And they're responding to 911 calls at about the same rate this year as we were this time last year. And open for business, but we have reduced the ability for people to come into the station for those needs. And we've also eliminated our outreach to in-person, more focused on social media and other creative ways that we can outreach with our citizens. But those are steps that we took early on to, number one, to protect our members so that they can protect our citizens by maintaining a workforce that's able to respond to 911 calls.
That's great. We're so grateful to you. We're about to hopefully pass a bill to get funding to state and local governments. And one of the big reasons is that your funding comes from local government. And we want to make sure that, you, paramedics, teachers, garbage, you name it, the things that we really just take for granted are there and safe. And I also really appreciate what you said about still responding to emergencies, because we've been hearing about increasing numbers of heart attack and stroke victims who aren't going to the hospital, who aren't calling 911. And so things are being caught too late. More people are dying because they're afraid to call or afraid to go to the hospital. And so I just want to reinforce that, while people going in for a minor illness might be an unnecessary risk, that if something's really wrong, please call on your emergency services, go to your doctor, make sure you get taken care of, because if there's anywhere that's good about infection control, it's rescue services and doctors' offices and hospitals. So thank you for being there. Would you like to have any other messages you want to make sure we get out there?
Well, that was an excellent message. Thank you for bringing it up. You said it well. I will just punctuate what you said by that. That is our actual experience here in Graham Fire and Rescue, that we're intervening later in calls and we're finding out just what you said, that people were hesitant and afraid actually to call 911. And our best chance for success in helping people is early intervention, as you know, doctor. So we did see an increase in at-home cardiac arrests, unfortunately, late in the episode. And so we address that in our website and social media outreach. as best that we could to try to get that word out that we are open for business. Please call 911 when you have a medical emergency. So I agree with you. You said it well. Thank you.
Well,
Doctor.
thank you. And in the meantime, avoid any unnecessary emergencies by being safe with fire. Well, thank you so much, Chief. We are thrilled to have you here. I know everybody watching is very grateful for your insight, and I want to thank you for your service and wish you all the best.
Thank you, Doctor, for having me. It's been nice talking to you.
Thank you. All right.